This is my audience. This is Abby and Allison. And my name is Anna Kate Snipes, and today I'm going to be speaking on the history and the changes in the nursing career. I'm going to talk to you today about the history of nursing, the changes in education, and the changes in the roles of a nurse over time. I'm a nursing major, so I've studied a lot on this topic, and I'm really excited to show you what I've learned throughout my studies. First, I'm going to speak about the history of the nursing career. Nursing is sometimes referred to as the oldest profession. In the beginning, the nursing career was started in the home. Nurses were not professionally trained. They were just performed basic care duties to nurse people back to health in their own homes. Nurses were also expected to clean up and keep up the homes in which they worked in. It was not until 1751 when the first hospital in Philadelphia was built. Even though the hospital was meant to take care and take in sick people, hospitals were not always thought of as a safe place. According to the National Women's History Museum.org, hospitals were thought of primarily as an asylum or a poorhouse. It took a long time for people actually to feel safe and enough to enter into a hospital and expect to be professionally cared for. The Civil War helped increase respect for the nursing career and helped move the care out of the home and into the hospital. Nurses began to wear standardized uniforms in 1861. The first nursing uniforms were not very ideal. They were white, long, apron-like dresses, and they also had to wear white caps to keep in their hair. And they were not sterile at all. They weren't. You weren't able to move well in them. Throughout the years, the uniforms were tweaked and changed to try to make them as efficient as possible. Today, nurses wear traditional scrubs. They're very easy to move in, and they're very easy to take care of. And they're very clean. They're easy to wash. And they're the ideal uniform for a nurse. Florence Nightingale made nursing what it is today. She helped modernize nursing and helped teach more advanced nursing techniques in her training school in Britain. After both World War I and World War II, nursing became a widespread career. The government began to push more and more money into the healthcare system, and nursing schools began to pop up everywhere. Secondly, I'm going to address the changes within the nursing profession, in the education in the nursing profession. Nursing school was not always ideal. Student nurses started out scrubbing floors and doing laundry, and they were basically used for free labor within the hospital. According to an article on Nurse.com, despite reports throughout the first half of the 1900s recommending schools of nursing be moved to universities, hospitals resisted until the 1950s, when advances in science and technology transformed healthcare. Once people saw how undertrained nurses were, there was an outcry for the change in education, and in the 1950s, the associate's program was produced because the bachelor's program, which was 4 years, was not producing nurses fast enough, and there was a really high demand for nurses in the 1950s. In the 1960s, nursing programs began to base the curriculum on critical thinking and teamwork skills in order for their nurses to be better prepared for the work field. Today, nursing education is completely advanced. There are 2- and 4-year programs, and there's also a 1-year program called Licensed Practical Nurse. Nursing students can study in traditional programs, or they can study online. There's a lot of online nursing programs now. There's also higher education available for a nurse with a bachelor's degree, such as a master's degree, and once you get your master's degree, you can go on to obtain a doctorate. Lastly, I would like to talk about the changes in the duties and responsibilities of a nurse. As I stated earlier, nursing usually took place in the home. It was not in a hospital. Until nurses began to be professionally trained, they did not know how to care for complicated illnesses. In the 18th and 19th centuries, it didn't have to do with how you were trained. It really just had to do with who was willing to do the work. And they were usually women. There were no male nurses. Nurses started out as caretakers and housemaids and were not highly respected in the community. The nursing career was really at the bottom of the barrel when it came to careers. Today, nurses are highly trained and they provide care for all patients' needs. They assist with surgeries, they administer medication, they assess patient progress, and they are with the patient the most. They are now seen as professionals in the healthcare field, and not just as an assistant or caretaker. According to MinorityNurse.com, they take on many more responsibilities than they ever have before and are seen as respected medical professionals. In conclusion, nursing has constantly evolved and changed since the beginning of the career. Nursing has evolved over the centuries and has turned into a highly respected profession. Nurses have gone from being basic care providers and housekeepers to highly trained professionals, and they are very respected in the healthcare field. They are expected to save lives, and they are the people who spend the most time with the patients. The healthcare world has exploded, and there are many opportunities for nurses in society today.